Hey everyone, it's Nikki over here at Buckeye Speech Path. I know it's my first video. I'm just hopping on to introduce myself a little bit and tell you guys my plan for this channel. So ultimately, I would like to provide short little videos on educational pieces related to the world of speech pathology and various disorders or things that we do to help treat the general public. So today I'm going to talk to you a little bit about vocal cord dysfunction, also known as paradoxical vocal fold movement disorder. This is an episodic condition that results when the vocal folds actually close when they should be opening. So when we take a breath in, our vocal folds open, and when we breathe out, we're nice and relaxed. So when someone has this condition, what happens is their vocal folds dysfunction. So they are actually closing when they're attempting to breathe in. So sometimes this results in noisy breath. It results in the feeling that you can't get air in. So if you hear me breathe and then out, it's just kind of a normal breath. Sometimes you'll hear people who have vocal cord dysfunction breathe noisy. In our world, we call that stridor or just a noisy sound with inhalation. So typically what we'll see is people who suffer from vocal cord dysfunction may have common triggers such as acid reflux can bring this on, so heartburn, postnasal drip sometimes is a trigger. We can also have people that get bothered by this when they have overused their voice and coughing, a lot of coughing, strong scents, even if they become emotional, and then also exercise. So exercise is a huge one, especially for young athletes. We see this a lot. So what's tricky is that this can be misdiagnosed as asthma because some of the symptoms and triggers are the same. The difference is asthma will respond to inhalers and medical treatments with medication, whereas vocal cord dysfunction will not. So sometimes it takes a while for a patient to find a speech therapist who can treat the condition and help them. But the good news is it's just behavior modification and education to kind of make a change and help you feel better and get through these episodes that can be so debilitating. Some of the symptoms of the vocal cord dysfunction can be throat or chest tightness. We already talked about noisy breathing and then difficulty getting air in or feeling like your throat's closing. Some people even say they feel like they're being strangled. So a speech therapist is your answer many times. Sometimes you have to go through several channels before you get here. But if this is something that you feel you're suffering with, please talk to your doctor because there is a solution for you. We aim to eliminate the source of the throat irritation and then control the triggers that would help you work through these episodes. Thanks for listening.